And the threshold to say that the Xolair worked was that they could tolerate, for example, for peanuts, they could tolerate 600 milligrams of peanut protein, which is the equivalent about half a teaspoon of peanut butter or about 2.5 peanuts.
Like Xolair is like a little teacher. They go in there and they're like, okay, I'm going to try to clean up this mess, you know?
I'm obsessed with that visual because I'm over here as the like spiral anxiety girly being like, oh my gosh, but what are the long-term effects?
I'm actually kind of optimistic that a cure is possible in the not too distant future, hopefully in my lifetime, or at least kind of, in my lifetime as a drug developer.
Hi.
Hello,
And welcome to EpiPod. Sarah is a mom to 2 little boys with food allergies.
And Danielle has navigated life-threatening allergies her entire life.
Living with an invisible health condition is so isolating.
The fear and the anxiety.
Trying to cover it up so you don't affect anybody else.
Especially your kids. Sound familiar?
Join us on the couch and take a load off with people who just get it.
We're so glad you're here. Welcome back to EpiPod.
Presented by Lorissa's Kitchen.
I'm so excited about today's episode.
I am it's been starred in my calendar for literally 2 months.
So I love when we are just talking about a topic, but then when there is a topic that everyone's talking about, like Xolair, this new medication that's on the market for treating food allergies.
Multiple food allergies.
Yes, all at the same time via injection. And it's something that is not introducing the allergen. I mean, these are big things, making big waves in the food allergy community. So I love that then when we have a topic like that we always say, we are not a doctor. We are not experts, but we can bring one on. And that's exactly who we have today.
I know. And I feel like this is like a selfish interview because I basically, I was like, I need more like anxiety girly. Like I can read all the literature. I can talk to my doctor, but like, let me talk to the company who makes it.
That's
so
right.
I have so many questions for him.
I know. And so we're talking about Dr. Larry Tsai, a physician, food allergy parent, and senior leader at Genentech, a pharmaceutical company. At this company, Dr. Tsai is the global head of respiratory, allergy, and infectious disease in product development. His team worked closely with the National Institutes of Health on the phase 3 clinical trial that supported the recent FDA approval of Xolair in food allergies.
In addition to being a physician with experience treating food allergies, Dr. Tsai lives with food allergies and has a teenage daughter with multiple food allergies. Dr. Tsai is intimately aware of the psychosocial burden of living with food allergies and is dedicated to improving patient care. Prior to joining Genentech in 2019, Dr. Tsai was a physician at Brigham?
Yeah.
Okay. Dr. Tsai was a physician at Brigham and Women's Hospital in Boston, an instructor at Harvard Medical School, and served as the chief medical officer at Tetraphase Pharmaceuticals.
Dr. Tsai holds a Bachelor of Science in Biology from Stanford University and a medical degree from Harvard Medical School. He is board certified in critical care medicine, internal medicine, and pulmonary disease. Dr. Tsai is based in the San Francisco Bay Area and enjoys running, biking, and traveling with his wife and 4 children, 2 of which have allergies.
Crazy. Okay, well, he's in the waiting room. Should we let him on in?
Let's bring him in. I can't wait to talk. Welcome to the podcast, Dr. Tsai.
Yeah, thank you so much, Danielle and Sarah, for having me here today.
Yeah. So for those who may not know exactly what Xolair is, can you kind of give a background on the actual drug, the medicine, and then also kind of the new approved uses for it?
Sure. Yeah. No, I'd be happy to do that. And maybe before I answer that question, maybe it's helpful for me to give take a step back and give a little bit of perspective. As you mentioned in the introduction, I am a pulmonary and critical care physician. And so I can certainly appreciate the serious unmet need of food allergies, severe food allergies, with over 17 million children and adults just in the United States, being affected. And prevalence, obviously, continuing to rise. I think probably you and your followers all know those numbers. But as you mentioned, I'm also a food allergy patient and the father of a teenage daughter with severe food allergies. So, I'm personally aware of the psychosocial, emotional, and developmental impacts that they can have on patients and their families. And this is why, I'm particularly excited that Xolair, as I mentioned, is now approved as the first treatment to reduce severe allergies to multiple foods following accidental exposure. And I really feel like it has the potential to transform how we treat this disease, both, in children and adults. And I feel deeply connected and proud to have played, a role in bringing this advance to the food allergy community. You wanted to understand a little bit more about, how Xolair works, and so let me explain. Again, taking a little bit of a step back and talking about food allergies to provide some context. After you eat some food, the protein, fat, and carbohydrates in the food are absorbed by the gut and then enter the bloodstream. And in people with food allergies, the body's immune system mistakenly sees certain food components, typically the proteins, as harmful, and then produces allergic antibodies called immunoglobulin E, or IgE. And then upon re-exposure to the food, these IgE antibodies cause the symptoms of an allergic reaction, including hives, swelling, and more serious side effects, including potentially, life-threatening anaphylaxis. So Xolair is a prescription medicine that's injected under the skin, or subcutaneously as it's called, that is FDA approved, as I mentioned, to treat food allergies in people 1 year of age and older. And Xolair works by binding to, deactivating, and lowering the levels of IgE. And because this is how it works, it can treat allergies to multiple foods sort of all at once. And Xolair is the first and only FDA approved medicine to reduce allergic reactions in people with one or more food allergies.
Wow, that's really helpful. Just from a layman's perspective, I always say I'm not a STEM girly. I was always an English and history lover when I was in school. And so I don't know, being 32 and living with several life-threatening food allergies, it is wild to think that there's something that can actually affect and help treat all of them at the same time.
Yeah, I think that part is really interesting to me too, because when you're in a treatment program like OIT, TIP, you're narrowing your focus. Like you're treating one at a time. And so something that can kind of blanket treat the almost underlying problem of allergies. Is that how you would think of it? So it's not necessarily like you're trying to treat the symptom like you would say if you're having a reaction, or it's not even like you're trying to just treat one of them. You are treating kind of the underground issue, which is these IgE that are binding and confused and causing this reaction when they get introduced to a food.
Yeah, I think that's right. I think that's how Xolair is different, from other treatments. And it's also, as you say, the reason why it can be used to treat multiple food allergies all at once.
Yeah. And so are you seeing a lot of excitement around it? Do you think people kind of believe in this? Are they jumping on board, patients and, in different allergist offices across the country? Is there any kind of hurdle to getting patients taking Xolair and being treated by this kind of new approved medication?
Yeah, I think that we are seeing lots of excitement. As you know, the food allergy community has been waiting for new treatments. And so I think as a result of that, there has been a lot of excitement from physicians and patients. The rollout is just beginning, but again, there is excitement, and the uptake has been very good so far.
That's such a good question, Sarah, because food allergy people, whether it's like anything new, a new medication, a new brand of crackers, like you don't want to try anything new. So I love that. I don't know how allergists think about it, but allergists and patients, I'm happy to see that there's excitement. And even I have so much trust in my allergist, in my doctor. He's like, I would say 98% of the reason why I'm living in Austin, Texas. And when I was like, well, have you heard of the Xolair thing? He was like, yeah, I have a lot of patients already on it. Like, do you want to talk about it? I was like, I do want to talk about it. So yeah, I've seen that excitement firsthand, actually.
Yeah. And so I guess my question is getting down to some of the specifics. I mean, this is a shot, right, that you have to take. What is the frequency?
Yeah, so the dosing depends upon your body weight and it depends upon your IgE levels, but it can be either every 2 weeks or every 4 weeks, depending upon those things. And again, it is a shot under the skin, subcutaneous, as you mentioned.
Yeah. Is that something that you always have to do in the office? Are there other options? Is that kind of still coming down the road?
Yeah, yeah. Maybe it's worth noting, actually, that even though this is new, this approval for food allergy, Xolair is not a new medication, and that's, I think, been helpful in terms of the uptake of Xolair as well for patients with food allergy. Xolair was first approved actually more than 20 years ago now for allergic asthma, and is also approved for a few other indications, including what we call chronic spontaneous urticaria or chronic hives, and as well as for nasal polyps, in addition now to food allergy.
Wow.
In terms of where it should be given. There are some potential side effects associated with Xolair. The most common ones, are relatively minor. They're things like site reactions or fevers. Site reactions are typically things like pain, redness, or swelling at the injection site, and fevers, as I mentioned. And these things are relatively uncommon. A more serious potential side effect is actually anaphylaxis to the treatment itself, but this is actually very, very uncommon. But because of that, it is recommended that the first doses of Xolair actually be given in the doctor's office under supervision. But actually, in patients who are at lower risk for anaphylaxis and who tolerate those doses, they actually can be treated at home.
Wow.
Outside the doctor's office.
Okay. I have so many questions because, as I mentioned, and as the people who listen to this podcast and our social media community, they know just how hard OIT has been for me. I am peanut and tree nut anaphylactic allergic, and I'm just still on the peanut, and it has been sort of like a moving target. So it's something, Xolair is something my therapist has brought up. It's something my allergist has brought up. Can you talk a little bit about, I feel like in food allergies, but a lot of different things. Food allergies specifically, the adults don't get as much attention and care as the kids. Like, I've heard that from TIP adults. I've heard that from OIT adults. I've just, in general, like, the studies are done on kids, and you're like, okay, but what about me? Like, a lot of programs don't accept people for food allergy treatment past 18, some are 20, some are 22. So I feel like, speaking as the food allergy adult sufferer in the room, I feel like that's a really common sentiment, is like, what about us? Can you talk about, have the studies, and has it been tested on adults, or was it mostly tested on children? And is that something, like, are adults at higher risk for having adverse reactions to it the way that adults are at higher risk doing OIT? Lorissa started Lorissa's Kitchen in 2016 with a simple mission to bring better, healthier options to the meat snacks category. However, after the birth of her third child and several challenging years helping him work through a laundry list of food allergies, she knew it was time to take that mission to the next level by providing these same high-quality, healthier options, but now to ensure that they are certified free from the top 9 allergens.
Lorissa's Kitchen is so proud to announce the first ever and only Menu Trinfo certified free from the top 9 allergen meat snack on the market. Check out LK on Amazon or their website, lorissaskitchen.com. That's LORISSAS kitchen.com. And you can use the code EpiPod for 15% off.
Also, they're available in Sprouts.
Yeah, no, it's definitely, this is an issue that I'm, very sensitive to. Again, being an adult food allergy patient, but also having a daughter, with severe food allergies. And yeah, I think what it comes down to is Xolair is approved for adults and children 1 year of age and older with, multiple food allergies. Children and adults were included in the various Xolair food allergy studies, including the main study that led to approval. And, in both children and adults, the IgE that we talked about, the role of IgE is quite similar, and thus Xolair can be an effective therapy, regardless of your age. Xolair, it's probably also worth noting, is approved in children and adults in those other indications as well, allergic asthma, chronic spontaneous urticaria, and those nasal polyps as well. And maybe another way of kind of answering the question is to tell you a little bit about my daughter's experience.
I would
that
love
be okay
that.
if I talked about her a little bit?
Yeah.
Okay, all right. Because again, she's gone from childhood allergies, and now she's an adult. So, maybe it's, as an infant, she developed severe allergies to multiple foods. That's kind of where it started. And at the time, standard of care was really strict avoidance of the allergens and pretty much nothing else. But at that point in her life, it was actually quite easy to do. Until she was a toddler and suddenly was sticking anything and everything into her mouth, including, potential allergens. And yeah, I'm sure it's quite familiar to you.
Yes,
right?
it is.
Like, that's my whole life.
Yes, it still is with my almost 4-year-old. I'm like, come on, bud, come on.
Yeah. Well, it continues, of course, because then she started preschool and elementary school, and there was a whole new set of challenges, including snack time and school lunch and school events that were serving food and basically producing other opportunities for accidental exposures. Then we got through that, and she's a teenager, spending more time outside the house with friends, getting into those rebellious teenage years, and so a whole new set of challenges, right? And that's what you have ahead of you. But now, in reality, I have to say I have to give my daughter a lot of credit because she is super vigilant and super responsible, and has actually gotten very good at managing her own allergies. But even with that, and with 2 doctors as parents, my wife is also a physician, she continues to have occasional accidental exposures, and in some cases we can't even identify what the exposure was, which I think, really points out what may be an underappreciated aspect of living with food allergies, which is, basically this. My daughter can avoid eating a handful of peanuts or a lobster roll. I mean, that's not really a challenge for her at this point. It's not a challenge for an adult. But, let's say she goes out to eat with some friends at a restaurant, has a sandwich that was cut with a knife, that was used to spread peanut butter and not washed properly afterwards. She could end up in an emergency room through circumstances that are completely out of her control. And I do think that constant anxiety has taken a real toll on her, as well as her parents, frankly, and has shaped her psychosocial development. So now she's going off to college, and we do worry that outside the familiar and better controlled home environment, she's going to start having, more reactions. So hopefully, that makes it pretty clear what the impact of a treatment that can reduce the risk of allergic reactions could be through multiple life stages, from childhood, from infancy to adulthood in a food allergy patient.
Yeah. You've mentioned this already a little bit, but this is not a cure. This is not something that's going to make you no longer have a reaction. It's just going to lessen. In very layman's terms, is that how you would describe it? Like, it's going to lessen the chances or the likelihood that you're going to go into full-blown anaphylaxis when you have an accidental ingestion?
Yeah, I think that's the best way of describing it. It's really reducing the risk, and reducing the risk of having a severe reaction. It really is meant to be used with continued strict food avoidance. And again, I can point to my own example and my daughter's example that, I think most people with food allergies, the goal is not necessarily to be able to eat that allergen freely. My daughter, even if she had a choice, wouldn't start eating peanut butter and jelly sandwiches. She really, the goal, is to avoid those severe reactions, avoid emergency room visits, and reduce the fear, and anxiety associated with these accidental exposures.
So yeah, I think that's why I'm struggling so much with OIT, because I'm like, I don't want to eat it. Like I've spent 3 decades avoiding that at all costs, and now you're telling me to eat it, and it has made my quality of life. I know the program is meant to make you more free, but it's actually made me feel quite the opposite. So I'm just so thankful. Like, who knows if I'll end up being a candidate for Xolair or if I'll end up taking it, but just the fact that there's another option is incredible. So,
what are the markers for candidacy? Did we already talk about that? Like, how do we know if Danielle is going to be able to take Xolair? Obviously a conversation with her allergist, right. But what are some of those requirements needed?
Yeah. So it's actually fairly simple. The requirements are not particularly restrictive. Obviously, you have to have documented IgE-mediated food allergies. And be at risk, for severe reactions. And then of course be in a child or an adult 1 year of age or older. But it really is, a discussion with your physician, your allergist, to decide whether it's the most appropriate therapy for you. It is the only treatment, as we talked about, that works by blocking, IgE. And I completely agree that having more options like Xolair is really just so important. That's such a big advancement, and we know, of course, there have been limited advancements for the food allergy community, in recent years. It's you mentioned kind of OIT. I'm actually very sympathetic to that as well. Again, seeing my daughter's experience, my daughter actually did go through OIT to peanuts. And it really was a challenge for her in terms of intentionally eating that allergen that she associated with those severe reactions. But it's also worth mentioning in the context of OIT that the Outmatch study, which is this phase 3 study that led to the approval of Xolair for food allergy, that study is actually ongoing, and there's a second stage that's looking at combining Xolair with OIT. So that might also be an option in the future.
Do you have to continue to take the medication in order for it to be effective? Like if you stop OIT, you lose the muscle that you've built up. Is it similar?
Yeah. We mentioned the next stage of the Outmatch study. That's part of what it's trying to assess is, again, what the durability of the effect is. But based upon what we understand about how it works, we do expect that you would have to continue to take it for it to be effective. Again, it's not a cure for food allergies. I think that for OIT, for example, if you stop taking the medication, then typically you have to kind of build back up to it again to re-induce the tolerance. It's not like that with Xolair. If you stopped it, you could start it back up again. But if you do stop it, then the expectation is that the effect would actually go away.
Are there a set of rules, or is everybody different? Like, is it something where you would have to do a food challenge to see like just how much this medication helps my specific body and my specific allergies?
Yeah, no, look, I wish that there were kind of hard and fast rules that you could follow, but yeah, every person is different. Every situation is different. What I can tell you about Xolair is, in terms of the way that it was tested in the clinical trial, there were food challenges, and basically, in order to get into the study, you had to have a food challenge and show that that you were sensitive, that you had an allergic reaction to actually a very small amount of multiple allergens, including peanuts, right?
I'm glad Danielle was not in the study.
I would literally be like, how many billions are you paying me? What?
Oh, really? Yeah.
To sign up to have to show I have to show you I'm having an allergic reaction.
But thank goodness people do.
Yeah.
Yes.
No. I mean, and maybe it's reflective again of how the degree of the unmet need, that there were plenty of people who were willing to go through this in order to get into the study. And then basically, patients were randomized to either receive Xolair or to receive a placebo. And after about 16 to 20 weeks, they actually had to have another allergen challenge, right? And basically, this. Yeah, that's right.
This is
another one.
Crazy, Dr. Tsai.
Yeah.
Okay, I'm done.
And the study showed that basically, patients who received Xolair could tolerate a larger amount of actually the allergen after being treated with Xolair. And the threshold to say that the Xolair worked was that they could tolerate, for example, for peanuts, they could tolerate 600 milligrams of peanut protein, which is the equivalent of about half a teaspoon of peanut butter or about 2.5 peanuts. And so the reason that I kind of mentioned that level of detail is that, that's actually typically a lot more than the accidental exposures that people get that trigger their severe reactions. So that's gives you kind of an idea of maybe the level of protection, that Xolair may provide. Every individual is different, of course, and you mentioned sort of other factors that can contribute, including exercise, including what else you're eating at the time, et cetera. So everyone is different, but that's really how it was tested, and that's maybe the kind of gives you an idea of the level of protection. It's also important to note that that's not like a whole peanut butter and jelly sandwich. Like I said, that's the reason why you actually have to continue to avoid the allergens.
Right.
But again, maybe it provides, sort of that peace of mind, that sort of safety margin for a lot of people.
Are there the kind of things that we have to do either in my son's program or Danielle's where you have to have this like hour rest period after the dose? You raise your body temperature in that kind of rest period. Is there any of that, or is it just like, give me a shot, walk out the door type of thing?
Yeah, well, as I mentioned, there are some potential side effects, and again, the most serious is anaphylaxis, which again is very rare. But that's the reason why actually, when you first start the medication, you need to be observed in the doctor's office to make sure that you don't have a severe reaction. If you don't have a severe reaction and you're not really considered at risk for having severe reactions, then you can actually go and pick it up from the pharmacy and actually, administer it at home. Either a parent can administer it to a child, or an adult can self-administer it, obviously. And then there's, there's no specific monitoring, beyond that. It's, obviously when you're doing something like OIT, you're actually being exposed to the allergen itself, and so there's a higher risk that you might have a bad reaction. In the case of Xolair, it's not like you're exposing somebody to the allergen. It's, like I said, there's the potential to have an allergic reaction to anything, including Xolair. But beyond that, if you tolerate it, there's not any expectation that you need to be observed or that you need to wait, as you're mentioning.
That's helpful, because some of the literature, I mean, that's such a holdup for me, the waiting period, because it's not just an hour; it's an hour of rest, but then it's 2 hours to do things like exercise. And in the past, like I went out into after the 2 hours was at a baby shower that was outside in 100 degrees. And I came home and had a huge hive, and it was not a bug bite. So that was determined. So that I can see being a dream for people to be like, oh, I know that I'm good. Something that I read, and correct me if I'm wrong, but it was saying you could have anaphylaxis directly after the shot, or even days later. Is that true?
Well, typically, actually, most anaphylactic reactions to Xolair would occur within the first 3 doses, and typically would occur actually shortly after the injection. Anaphylaxis, like I said, this is all individualized, and there are cases of sort of delayed anaphylaxis, either in patients who have been tolerating, their medication just fine, and at some point, for whatever reason, something changes and they start to have allergic reactions to it, or that it's delayed beyond, the typical, few hours within which an allergic reaction would occur. But this is uncommon. The most typical thing, like I said, would be within the first 3 doses and within a few hours after the dose.
I keep circling back, just I have such a heart for your daughter, going off to college, and you as parents thinking it's food allergies aside, it's just a big moment for a family and for a person, but for the parents,
yes.
It's really big. Do you mind me asking if she is still, did she carry on with her OIT?
Yeah, she has actually.
Oh,
and
wow. So she's going to do that by herself in college.
Oh yeah, and like I said, she's very, she's a firstborn.
Yeah.
She's very responsible. I think actually having food allergies has taught her to actually be, responsible. Like I said, not without its costs. But she, I dropped her off, at college last week, and one of the first things we did is we went and bought a big jar of peanuts for her so she can continue to take her OIT. So she's continuing with it.
Oh my gosh! And did she do it for shellfish too?
No, she has not done it for shellfish. It's we've thought about that over the years, and it's for her. It's peanuts, certain tree nuts, walnuts, pecans, and shellfish are kind of the main ones. She had many more allergies than that when she was younger, but she actually fortunately outgrew them. Milk, egg, these other ones. But we have not actually done OIT for shellfish or for the tree nuts.
Interesting.
These are typically a little bit harder to do than peanuts. I think most of the experience is really with peanuts, but for various reasons we haven't done the OIT.
Yeah.
We've talked about the Outmatch study a little bit, but what else is in the future? Just looking ahead, knowing what you know in your world and being so involved with Xolair, what is the next thing on the horizon, either for Xolair or just in general in terms of food allergy treatments and options out there for families and people with food allergies?
Sure. Yeah, I look, with 17 million children and adults in the U.S., out there in the rising prevalence over the last few decades, we're really excited, obviously, about the Xolair approval, which builds on, the 20-year plus year experience, in other indications. And we're, like I said, encouraged by the early response after the FDA approval with, I think the numbers are something like more than 15,000 food allergy patients now prescribed Xolair. And, as I mentioned also, looking forward to seeing the additional data from the next stages of the Outmatch study, including, the use of Xolair in combination with OIT and expecting to have some results from that next year. But Xolair, as we talked about, is not a cure for food allergies. And there's still obviously a real need for additional innovation. I can't necessarily, point to anything very specific that's really kind of coming down the pipeline immediately. But I do think that the encouraging thing is that our understanding of food allergies and the role of the immune system is really growing in leaps and bounds, to the point where I'm actually kind of optimistic that a cure is possible in the not too distant future, hopefully in my lifetime, or at least kind of, in my lifetime as a drug developer. And I think I can speak for myself and Genentech when I say that we would really love to play a part in figuring out that cure.
Yeah. Man, when you even utter the words cure, like my whole body tingles, like the goosebumps on my arms, because I know. I mean, I think that's just, I'm so thankful, as you are, like you mentioned, as being a food allergy dad, food allergy mom, like, you dream a life for your kids that isn't one of fear, isn't one of, feeling othered in any type of situation. And, you're desperate for any and everything to help them live this full, beautiful life. And that's why, for me, I'm flying across the country every 10 weeks and spending a bunch of money on this treatment. And, this is why Danielle is putting herself through this program, even though it's hard on her mental health and her, social abilities to go out and do what she wants to do. And so the idea of like, one day possibly there being a cure is just, it's the absolute dream. So the fact that you're hopeful sitting in the seat that you sit in really means a lot to me, and I think will mean a lot to everyone that's listening to this podcast.
No, it sounds literally like the alarm clock is about to go off and I'd be like, oh, I have to text Sarah. We were talking to this doctor and he was actually even hopeful.
Yes. No. And I guess we can wrap it up here pretty soon, but what do you think? I feel like all of a sudden we're seeing all this new understanding about allergies, and we're seeing all of this new research and all of these, drug manufacturers coming out with things. Why wasn't that the case 20 years ago? I mean, I know the prevalence was lower. You talked about that, but why all of a sudden are they looking into it? I'm like, why did you do this 20 years ago so that my kid could, have this better life now? Why now?
Yeah, I think it's a combination of factors. I think obviously, there's more of an appreciation for, it's not just that the prevalence is rising. I think there's actually kind of more awareness, and that sort of actually, we uncover sort of the true prevalence once we're actually looking for something, obviously. I think that there's also, of course, that our scientific understanding of food allergies really has changed. Like I said, it's continuing to grow in leaps and bounds, but it's actually already, improved dramatically over the last 20 years. The other piece of it, I think, is that the clinical approach to allergies has changed quite a bit. We talked about how strict avoidance was felt to be kind of the only, way of treating food allergies. A couple decades ago, I think allergists would have thought the idea of doing even OIT was kind of crazy, right?
Totally.
So I think, so the availability, I think, of treatments, including Xolair now, I think, that's part of what's kind of driven, I think, the increasing awareness. Because obviously, once you have something to treat, the disease with, it makes a lot more sense to be, making sure you can pick it up and make an appropriate diagnosis to be able to offer treatment. So I think it's really a combination of factors that's kind of led to where we are.
Yeah.
So helpful.
Well, thank you so much. Is there anything we missed? Anything else that you think parents or just people out there with allergies might want to know about Xolair, or just the future of allergy treatments in general?
Yeah, look, I mean, just maybe kind of at a high level, hopefully it's really clear from this discussion why I personally am really passionate about food allergies, both at a personal and a professional level, frankly. And maybe I would emphasize that to your followers that, Xolair, as the first treatment approved to reduce severe reactions to multiple foods, really has the potential to transform how we treat food allergies. And this is obviously so important when we consider the burden that this serious condition places on patients, families, and their healthcare systems. But it's not a cure. Needs to be used again in conjunction with continued strict avoidance of the allergens. But even beyond Xolair, like I said, I think that there's reason for hope that there are better therapies, coming down the pipeline, including the potential for cure.
Thank you so much for taking the time to talk with us, Dr. Tsai. This has been informative and invigorating, and we're, I think, going to leave this conversation very hopeful.
Yeah, I was like, it's a shot of hope, no pun intended. Yeah.
Thank you so much, Danielle and Sarah.
That was so helpful.
I know. I really like hearing from somebody. We've said this before when we were talking to our mental health guru that was on. She was somebody who had allergies herself. And so I love that he not only has allergies himself, but his kids have allergies. So he's speaking from like the scientist doctor background, but then also like he gets allergies. He's one of us. You know what I mean?
You know what's really interesting is I have never had any sort of healthcare provider, like allergist, GP, is that what they're called?
General
GP.
practitioner.
Okay, great. For a second I thought I said a bad word. Anyways, I've never had any of those providers say in a row the physical, the mental, I don't know exactly how he stated it, but it was so eloquent of like, it affects your relationships, it affects your mental health, it forms the way a person grows up.
Yeah. Spoken like someone who lives it.
Yes.
You know
but
what I mean?
had like a whoa moment where I'm like, oh my gosh, I didn't realize that nobody has ever spoken. It's either like a mental health professional, somebody who gets it, and then every other medical professional over here. Mm-hmm. And that was so special.
It was. And I really am hopeful. I think that this whole like, you're not having to eat the food to gain the tolerance. It's like, it's basically like going in, it makes me think of like, I know this is so silly, but it like makes me think like the shot's going into your arm and there's these little like armies that like go out and they're like, we're going to fix these cells, these bad cells that are like, confused.
Cells. They're good cells.
They're good cells. Yeah. But the confused cells and be like, no. Here, it's like a little teacher. Like Xolair's like a little teacher. They go in there and they're like, okay, I'm going to try to clean up this mess,
I'm obsessed with that visual because I'm over here as the like spiral anxiety girly being like, oh my gosh, but what are the long-term effects? And like 20 years, that's actually really helpful. But how come it's not 120 years? Because how do we know that it doesn't cost me to grow a third arm? Like, my brain just gets on a roller coaster. And then by the end of the roller coaster, you're like, okay, where did we turn wrong? Like, what's happening?
I do like though that it's this is not a new medication. Mm-hmm. It's new for this ailment, like this condition, but it is not new. So they really do have a lot of like understanding of the drug. And then now we just know that it can also help with this.
Yes.
So I think that's really helpful for people who are a little more fearful of taking something new.
Yes. Other people who have anxiety disorders.
Yeah.
But it reminds me of like the Wegovy, Mounjaro. What's the most popular of it? The weight loss drugs.
Ozempic.
Ozempic, yeah.
Like it has other uses, and then all of a sudden they're like, oh wait, you can lose weight.
Right. It's been used for diabetics and other conditions for years and years and years. And that's why all of a sudden when they started using it for the weight crisis, it's like, oh my gosh, now we have a supply and demand that needs to be seesawed, evened out. And now it sounds like it has been, but that's exactly what it reminded me of.
Yeah. And then when he said, like, oh, I can't pinpoint anything. I don't know anything. Like literally, I don't have knowledge of a medicine that's going to be a cure. But like in all of his understandings of the industry and of the science, he thinks it's possible in his lifetime. I mean, he's a little older than us, not that much older than us. So he's still got a long way to live. But like, it's like that's soonish. Like that's
what-
not that long.
When he was talking about like, and we may like, I'm hopeful that one day we'll have a cure. I was picturing myself as like the old lady on Titanic throwing the like necklace off. I'm like, will I be like 95 years old? And they're like, Danielle, look, there's a cure.
I hope it's in the next decade. Like
Totally.
that would be amazing. Even 10 years from now, I'd be like, wow. And I think that would be fast, to be honest. Like I think these trials take years and years. And so I'm not hopeful it will be in the next 5 to 10 years, but I mean, I want it to be.
Well, I always think about older me. Like part of the reason I was willing to try OIT is I was like, who am I going to be? It's just seeing my own grandparents who have now passed, but seeing how it's like you're a child, then you're an adult, then you're a child again.
Yeah.
And like, how would I be able to advocate for myself when I'm in that life stage?
Yeah.
So I don't know, even if it is when I'm old, I'm going to be stoked.
Yeah, you're like, whatever it is, give it to me.
Yeah.
I will take it.
Yeah.
Well, thanks again to Dr. Tsai, and we'll link to all his information in case anybody wants more. Go down the Google rabbit hole, or not really Google, but like specific good information. But definitely something I think you, coming from Sarah to Danielle, should look into and talk to Dr. Silvers about, because I just think this could be a really big life-changing thing for you.
I know.
Yeah.
Makes me want to cry.
Aw.
I'm not going to.
Okay, let's do questions.
We don't have time to cry because we have questions to answer.
These question and answers are brought to you by Inchbug, a waterproof personalized name label company for kids. You already know how much we love their labels for keeping water bottles and lunch containers clearly labeled for school, but
Inchbug is currently giving our listeners 30% off of their allergy bag tags on Amazon. Find the link in our show notes and get personalizing.
let's do it.
Okay, first is like kind of rapid fire, but knowing us, it will turn into a dissertation. Sarah, tip or not, is it worth it?
Ooh, yeah, that's short and sweet, but long-winded for sure for the answer. But I'm going to keep it short. I don't think there's like a 100% answer that will apply to everyone. For us, I think it is. I actually was getting ready to come here today, and I was watching one of my tip friends, like moms we've met in real life, but like met on the internet, and her daughter just had her like tip graduation, and we started at the same time. She just had a shorter plan than us. And there's still things in graduation that I was learning about. Like she was like, oh, we still have to do this for 8 weeks and then do this, like a step down kind of thing. And so I was learning, like watching her as I'm like putting on my mascara, and but then at the end she said, like, this is the hardest thing I've ever done. And I just got chills because I related so much that like, it is so brutally hard. Like physically, mentally, like every piece is hard. It's hard watching your kid go through it. It's hard doing it yourself. It's hard when there's little bumps in the road, little reactions. It's even hard when they're doing super well because you're waiting for the other shoe to drop. It's like, it is just hard. And so I say it's worth it, and it is for me because I have the support system. I have some, family members that are contributing financially. Like, it is worth it for me because even though it's super hard, it is still doable because of the resources and support and the child that I have and the success that we've had, so that's hard to say that everyone's going to feel the same way as me. But I think given the right circumstances, it really is worth it to know that like my kid just ate 6 freaking peanuts.
I was going to say.
Dust caused anaphylaxis. Now he's eating 6.
Peanuts is crazy.
It's crazy. And so it's like, okay, how is that not worth it? Like saw my arm off and it's still worth it.
Yeah.
If he's going to be protected for the rest of his life. Do you know what I mean?
Totally.
So
saw
it's
my
like,
arm off. Like Sarah.
That was graphic, but it's true. Like moms out there, they'll know what I'm talking about.
And tip moms out there will be like, you know what? It feels like my arm's being sawed off.
Yes, it really does sometimes. But like, yeah, so that's a long-winded way to say, yes, for me, it has been worth it. The caveat, and then we'll move on to the next question, is that OIT at the time that I enrolled Graham into TIP was not available to me. At our allergist, they told us, no, he's not a candidate. At our allergist, they said, no, we don't even do milk OIT. At the time, I think I reached out to a few others, but I didn't know. I think there was one, Dr. Silvers in town, that even at that time was starting to do more and more OIT for different allergens and things. But like it to my knowledge, it was not an option to me. So tip was the only option.
Yeah.
So the caveat is it might be better for you to do OIT instead of TIP. So I think regardless, the work is worth it in OIT for backtrack. OIT or TIP, I think if you have a child, a kind of like normal, typical allergy child, I would say yes. In terms of OIT versus TIP, I think you should explore all the options and really weigh the pros and cons, because there's a lot of cons to TIP. There's also a lot of pros, but look and see what is out there.
I will say though, as the person who's in the trenches of OIT, I haven't dosed in a month. Cat out of the bag.
Oh my gosh.
It's fine. We'll deal with it later.
Yeah.
But like a big part of it is I'm like, I don't know if I can do this for the rest of my life. If somebody was like, okay, this is your life forever, would you be able to do TIP forever?
Yeah, no.
Yeah. So I'm not in the TIP trenches, but that is like something I'm so envious of, like the fact that you guys have food freedom, quote unquote.
Yeah.
Even if there is a step down or there is some maintenance.
Right.
But like,
it's not daily. It's not constant. It gets to the point where it's hopefully even bi-weekly, which is like, oh gosh, that feels like nothing.
Right.
You know what I mean? To some
Saw
people,
my arm.
Yes. 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 Okay. Question 2.
Yes. Coworkers complaining on work trips about having to eat at a restaurant because of allergies.
You want to start?
I would say, would you prefer to have the trauma of witnessing somebody in a life-threatening situation? How do you feel about the whole trip being derailed because emergency services has to come and figure out how to save somebody's life?
Yeah.
Like, oh, I'm sorry that you couldn't eat at Panda Express or wherever, and we had to eat at Chili's instead. I'm sorry that this is a very small inconvenience on your little day. It's like, try living with this. Try having an ounce of empathy. I think this person, it's giving HR. It's giving good night. It's giving, I hope you get an adult onset allergy to 5 things, and then you can feel firsthand what it feels like for a spoon to get mixed up in the kitchen and then be fearing for your life on a Tuesday when you were just trying to get a latte. Mic drop.
Mic drop. Amen.
Good night. I hate this person with my whole being. My blood boils and I hate them. And this is why I don't work in corporate. Just kidding.
I think that this is the way a lot of parents feel when they hear other parents complaining that like they can't pack a PB&J for their kid to bring it to school.
You're so right. I'm like, grow the up.
Yes. And it's like, okay, we could go into all the specifics about how some studies say it's actually safer to not have a peanut ban and all, there is research out there showing that maybe peanut bans and things in school isn't the answer to our problems.
Right.
But if it's in place, or if it's currently really helping a specific student where they need to not be around a peanut, and you want to bitch and complain because you can't, for that 6.5, 7 hour window, pack a peanut butter and jelly for your kid, like go fly a kite. You know what I mean? Like, go take a little walk on a short pier.
Go fly a kite.
I already said bitch, so I was like, I gotta
kind of even it out.
We gotta even it out with some niceties. But I'm like, unless there is some off thing, people always like to say, well, my kid there's a condition, I can't remember the name of
ARFID?
it. Yeah, where like they only can eat 2 foods because whatever. I sympathize with that. My gosh, my kids are a very, very picky eaters.
And
so
restrictive because of their own personality and restrictive because of their safety.
Right.
Like, you get it.
Yes. And even though I might not get the fact that like my kid only eats 2 food, like if they have that condition, I'm the first one to sympathize and empathize with you. I'm not talking about those parents. Those parents have a right to figure it out and to collectively, the school, figures it out, right? Like they just separate towards the end of the table, you know, those two kids, or, you know, there are ways.
This classroom is a nut ban and their classroom isn't.
Right.
And this kid knows to wash their hands after lunch because then they all go to recess.
Like,
there are ways around it.
Just work together.
But that's 0.000%. And probably not. Like, that parent is probably being like, how can we work together? They're not the ones being like, oh, we're not having a food activity this year.
Yeah, get out of here.
Good. I genuinely think that I'm like a nice person. However, I wish such ill on these type of people. I genuinely wish ill. Curse on your family. Curse. I'm getting hocus pocus. I hate them.
Yeah, it's okay.
Yeah.
It's okay to be mad.
If my mom's watching, she's gonna be like, I raised you better than that. No, but it's true. I hate these people.
It's okay. It's all right. Well, you're allowed to be mad at your work friends, in quotation marks, friends. They're not your friends.
Vile coworkers from the depths of Davy Jones' locker.
Yeah. I mean, she should just, I don't know. I was going to say, like, go off and, like, go to even fancier restaurant.
We didn't even answer the question. We just, like, commiserated.
Yeah.
I mean, as somebody who used to work in an office with a big, you know, workspace, open, whatever. It's sort of like how you respond to anything. It's just like, okay.
Yeah.
Like, let them listen back to themselves. And, like, that's not even somebody, don't waste your energy trying to educate or make sense of it. Just be like, okay, and move on. And hopefully they have really good, like, when I was in the workplace, I had like 3 of my best friends, and then a guy started kissing too. But, like, they all, like, watched out for me. Like, if somebody brought, you know, a vendor didn't know,
right,
they just were, like, trying to get in with the sales team, brings in cookies. They're like, hey, they'll put it in Slack. I didn't even see the cookies. I'm not even coming until noon. Like, hey, like, looks like there's some walnut cookies on the table. Like, everybody remember nut allergy, like, wash your hands if you have one. Like, having other people who have your back, or then they are the person who's being unkind is the odd one out, not you for something you have no control over.
Yeah. And if they're wanting to go out to lunch as a team and picking places that are unsafe for you, I mean, you could also make it really awkward for them and weird. Like, you could go to lunch and just sit there, you know, like, and not have anything and make them feel really bad about it. Do you know what I mean?
My boss was, like, really nice and definitely did not do this on purpose. But once we had a meeting at a Thai restaurant, he would, like, take us to a new restaurant every Monday for lunch, and we would do our, like, meeting there. And one time it was a Thai restaurant and I didn't realize it until we got there, and he had just, like, it slipped his mind. He was just like, I tried this new place this weekend, like, we should all try it. And we were like, oh, let's go try it. And we walked in and I was like, So we literally sat down and I was like, hi, I'm super uncomfortable. The whole place smells like nuts. I'm going to say what I have to say. Like, here's my update. I'm not even gonna have a water. Like, I gotta go. And he was like, oh, no problem. That meeting lasted for forever. And I basically just, like, took the rest of the day off. I was like, I'm gonna go work from home. This is, like, pre-work from home being normal.
Yeah.
Every single one of the girls on the team text me. They're like, I'm so jealous that you're working from home. I can see your location. You're on the beach.
Hey, there aren't many perks to this food allergy life, but when you have one, you gotta take it and run.
Yeah, you pedal to the metal.
Oh,
I love it.
Goodness.
Okay, great. Well, thank you so much to Dr. Tsai, to our sponsors, and to you guys for taking the time to spend your day with us. Yeah. Please write us a review, and if there are, we have, like, actually quite the little pipeline of episodes coming up for you guys.
Yep.
But if you have any ideas, our DMs are always open.
Yes. Please send us a message and questions for our question and answer, and we'll see you next week.
See ya.